We're now doing local biomechanical exam for hip extension mobility dysfunction. And remember, our modified Thomas test or our Faber test are the tests that brought us here. We're going to take the leg and just rest it on our thigh. This is the easiest way of getting them in this loose back position, giving us access to do our local biomechanical exam. And we want to see if the ball can move in the socket, just for basic springing. My top hand is going to be finding the greater trochanter and is going to angle down towards the opposite knee with my forearm in the same line, and my bottom hand is going to pretty much be in a straight line across from the top hand. Forearms are facing each other. Now we're going to check the hip joint here in all three planes, but remember, specifically for hip extension, we're going to bias the AP direction, so towards the floor and towards the ceiling. So in this position, we're going to move down towards the table, up towards the ceiling, again looking for movement there in the hip joint. We're going to move down towards the right knee and up towards the left shoulder, back and forth. And last parameter is the rotation. So by side bending my body one way versus the other way, I'm checking the rotational parameters. So again, down to the floor, up to the ceiling, down towards the right knee, up towards the left shoulder, and our rotational parameters. You're looking for any restriction or rigidity in any of these planes. From here, we're going to transition to the prone position to check for the anterior capsule, which is a big part of hip extension. Anterior capsule restriction or tightness is a big part of limitation in hip extension, and having the client in a prone position is a really good way to evaluate that. We're going to obviously check both sides to check for symmetry. We're going to get one leg flexed all the way up, and you're trying to find the greater trochanter. Your pressure is going to go straight down towards the floor, and you're just looking for spring. And you can see that Kyle here does have the spring on this right side. Let's compare to the left. Again, fighting the greater trochanter, and way more restriction. I am met with immediate resistance when I try and induce any kind of springing on this left side. So this is checking for anterior capsule extensibility, which is a big part of extension in our hip extension mobility dysfunction. Also, one other thing to consider is pelvic orientation, the relationship of the socket to the ball, so the iliac versus sacrum plays a big role in your hip's ability to extend. So you will have to do local examination on the pelvis to make sure that a pelvic orientation problem isn't causing the lack of or limitation in extension.